My presentation will focus presenting some data on efficacy trials, testing self-help plus, and doing what matters in terms of stress in European countries and in other bordering countries. I'm starting with this outline of the whole webinar. I will present some evidence on self-help plus intervention tested in randomized controlled trials and some implementation strategies that we are developing and testing within the URISE project, and of course informed by evidence of efficacy. Then my colleague Monica Bartucz, a postdoc researcher here at the University of Verona, will go a little bit more in detail into the contents, activities, and mechanisms of action of these WHO intervention strategies to familiarize with SH+. And finally, as Monica said, we'll have the opportunity to discuss with expert trainers in SH+, some challenging potential barriers and facilitators that they experienced and managed during the training of trainers and training of facilitators in SH+ throughout their experience. So this is the intervention we are talking about. It's called Self-Help Plus, is a brief guided self-help psychological strategy inspired by the acceptance and commitment therapy and developed by the World Health Organization. It's composed of two main parts. We have a pre-recorded psychoeducational audio complemented by an illustrated guide in which the contents are very similar of those explained in the audio course. It can be delivered in group settings, in very large groups, actually, up to 30 people at a time, in the native language of participants, and each session can be delivered by briefly trained facilitators without a formal training or background in mental health, but with a specific training focused on self-help plus, and potentially with a migration background. After it was developed, but before its publication, its formal publication in the WHO website, we tested the efficacy of Self-Help Plus as a preventative strategy to reduce the frequency of mental disorders in vulnerable population groups. And these activities were performed as part of the Redefine project funded by the European Commission. So our research question was related to efficacy of Self-Help Plus in preventing the onset of mental disorders among refugees and asylum seekers resettled in Western European countries and in Turkey. We developed a consortium. This is our consortium, which included people from the WHO in Geneva, together with the University of Verona, who was the coordinating center, but also many other sites in Europe and also in Turkey. And this is what we actually did. We implemented the intervention in group settings, as I mentioned, with people meeting in person here at the University of Verona and in each site across European countries and in Turkey, for completing the 5 sessions composed of the audio course plus the book. Our aim was, sorry, I'll go ahead. Okay, this is our aim and our design. So we included people with increased level of distress according to the General Health Questionnaire, but without any formal mental health diagnosis, according to the mini neuropsychiatric interview. After the screening, we provided people with the Self-Help Plus versus enhanced usual care. And then after the end of the intervention, at 6 months and at 12 months follow-up, we measured how many people developed a mental disorder. Together with this outcome, which was our primary outcome, the frequency of mental disorders at 6 months follow-up, we collected also other clinical measures related to depressive symptoms, PTSD symptoms, anxiety, functioning, well-being, and some basic fidelity checks and implementation measures. This is the whole project. These figures shows what we did actually in each phase. So we started with the preliminary assessment of migration flows towards Europe and bordering countries. We identified the target population groups, and then we adapted the intervention following standard WHO protocols for adaptation. Then we conducted 2 separate randomized control trials, one in Europe and one in Turkey, to test the efficacy of self-help plus in reducing the frequency of mental disorders. These are the results for the trial conducted in Europe for the binary outcome related to the frequency of mental disorders, and the intervention was effective in reducing the frequency at post-intervention, as you can see from these graphs. However, the difference between the 2 groups at 6 months follow-up, which was the medium-term efficacy information composing our primary outcome, was not clinically or statistically effective. So we identify a strong and significant effect at post-intervention only. These are the other results from the other outcomes that we collected, and we identified a strong improvement in well-being outcomes, both at post-intervention and at 6 months follow-up. While for other clinical measures, we identified improvements at follow-up or at 6 months, but without drawing firm conclusions from this data. Our data are already published. These are the 2 main papers we publish with the results at 6 months follow-up and post-intervention, the first paper, and the 12-month follow-up for the second paper. And after these results, we were able to conduct partially in parallel the other randomized control trial in Turkey. Of course, the implementation of the randomized trial in Turkey was a little bit different because of the context. Turkey hosted the largest number of Syrian refugees. So the target population in Turkey was composed of Syrian refugees only, mostly living in precarious conditions and in refugee camps. And we identified 2 main cities, Mardin in the border between Turkey and Syria, and Istanbul for the implementation of the trial. And we conducted our trial liaising with NGOs implementing a reception project and support for refugees and asylum seekers. We were able to recruit 642 participants in total in Turkey, and we did a comparison between the 2 groups assigned to SH Plus and to enhance the usual care, but the groups were very similar in terms of social demographic and clinical characteristics. And these are the results for the Turkey trial, in which we identified a strong and beneficial effect of SH Plus in reducing the frequency of mental disorders at 6 months, while at post-intervention, the intervention SH Plus was not clinically and statistically effective. So we identified quite different results between European countries and Turkey, and we interpreted these results considering the context in which self-help plus was implemented. And of course, at the time these trials were conducted around 3 years ago, the contexts were quite different. I summarized here some challenges that we managed in the European and Turkish trial. We had similar challenges actually in recruiting participants because we decided to design a true prevention trial in which, of course, we had to follow very strict inclusion criteria, selecting people with increased level of distress, but without any formal diagnosis of mental disorders. And we had to administer to each of our participants the mini neuropsychiatric interview, which is a bit time consuming. We also have relatively high dropout rates due to our target population, which is a population in transition by definition. And we had to manage some emergency situations related to the start of the public health problem related to the COVID-19 pandemic. So we switched our assessment from the in-person assessment to the remote follow-up. And also we had some heterogeneity across groups included in our studies, because in European countries, we have to manage different groups coming, for example, from Pakistan, from Afghanistan, from Syria, and from Nigeria, while in Turkey we had one population group which was coming from Syria. So we had to adapt the intervention and the assessment modalities according to the type of population groups we were interacting with. These are some implications of our trials and of our project. Of course, the trial in Europe and the one in Turkey are the first prevention RCTs conducted among refugees and asylum seekers living in Western Europe and also in Turkey. Probably the trial in Europe is the largest intervention study conducted with refugees living in European countries. And we identified that SH+ was effective in reducing the frequency of mental disorders in the short term, but not in the long term. So now we are trying to assess modalities to keep the beneficial effect of SH+ also in the long term. And we developed a new European funded project called ADVANCE with a new large consortium in Europe led by Professor Witz et al., trying to test these new implementation strategies for delivering SH+. And of course, probably SH+, if these beneficial effects are demonstrated also in the long term and also across different countries and settings, SH+ is a feasible strategy to be implemented. These are the main publications for the trial in Turkey, in which we were able to publish both a paper on effectiveness data and on cost effectiveness data, trying to measure the costs related to delivering SH+ versus the costs related to managing mental health conditions in people not receiving any type of intervention. And SH+ was a cost-effective strategy compared to treatment as usual in reducing the costs related to access and use of mental health services and health services in general. So after collecting these data on efficacy and effectiveness of self-help plus in across different vulnerable population groups, we reasoned about the possibility of expanding our focus, trying to move a step ahead in relation to the implementation strategies for WHO psychosocial intervention. So we were able to complete this first step in this figure, the experimental studies, to prove efficacy for these interventions. However, we reasoned that the subsequent phase was still missing and very necessary for being able to implementing and scale up at a large scale our intervention strategies. And so we developed this URISE project, trying to move a step beyond efficacy data and trying to identify the best strategies for implementation. So very shortly, URISE aims to improve the mental health well-being of refugees, asylum seekers, and displaced people in general coming from Ukraine, trying to build a model, a sustainable capacity model for implementing mental health and psychosocial support interventions, so self-help plus, doing what matters in terms of stress, and PM plus, adapted to meet the specific needs of war-affected refugees and asylum seekers. So we have three main objectives: to mobilize and create European networks of Ukrainian and Russian-speaking mental health professionals and paraprofessionals, to exchange and implement practices and experiences related to mental health and psychosocial support, then to try to do a capacity building exercise to enable people and also NGOs to use and implement evidence-based psychosocial interventions, and then, of course, to build plans for sustainability and to scale up and transfer our intervention strategies across different European contexts. These are our activities, which are mainly composed of training activities and testing of implementation strategies. We are doing training of trainers and training of facilitators activities, and we are inspired by our experience in Redefine. These are some pictures of the training of facilitators that we conducted in Italy and in Turkey. Very easy activities which were very helpful in allowing implementation and scale up of SH+. This is the training of facilitators in Verona, and this is the training of facilitators in Turkey, in which we implemented a very similar model for training a large number of facilitators in implementing Self-Help Plus. I'm concluding before leaving the floor to my colleague Monica. These are the next steps that we aim to implement in the next few months within the URISE project. We aim to complete the training of trainers and training of facilitators across Eastern European countries. We are conducting qualitative studies to identify barriers and facilitators of access and use of WHO intervention strategies for and with vulnerable population groups. And we conduct observational and implementation study in Eastern Europe, also to collect some data related to clinical outcomes. So thank you very much for attending my part. If you have any questions, you can use the chat or send me an email.
Marianna, if I may, I would like to first say thank you. Thank you so much. This is incredible that we have this opportunity within the project that is being implemented in order to help to support mental health of Ukrainians in Europe, that we have this opportunity to collaborate with Verona University and US partners. That's incredible. The scope of research that you've conducted already, and also what has been planned within URISE project. Also, congratulations on your publication in the World Psychiatry Journal. I know that it is quite a challenge to publish a research paper in that journal. That's one of the journals with the highest quotation indicators for mental health. And my question is about the high indicators for people who dropped off from the research, because you mentioned that the category of refugees, this is a category of people who move, who are on the move, who are traveling. I believe that in our research, in our URISE project, we will also encounter this issue. Maybe you could comment on that. I mean, the risk of dropouts, and what did you do about it in your research, and what we need to take into account now at the point of selecting the trainers and facilitators. So what could be done there?
Okay, thanks. I'm not hearing very well, but I got the main question. So what we try to do with our population groups, and Giulia Turrini, my colleague here at the University of Verona, will explain more these activities that we try to implement to engage people. Actually, we try to engage them following up very often with phone calls, trying to engage them in our activities, sending reminds very often, at least for the period of time we were sure people were living here in Italy. Then, of course, there's a proportion of people leaving because, for example, in our case, Italy was not their final destination. So in this case, we try to assess this aspect beforehand, so before randomizing people, but sometimes it's impossible to foresee these kind of movements. So we try to engage those people attending, trying to follow them with often calling them often, trying to have people coming here in our university for the sessions in person, providing reimbursements. So we try to engage as much as possible. And yeah, the dropout rates were high. We cannot ignore this aspect. But considering this population group were quite, in the mean, around the mean numbers of dropouts that we see in other trials. So we can say that despite the COVID emergency and many other problems, we were able to collect significant data from our sample.
Thank you.
Okay, thank you very much for your presentation and for this discussion. Now I will be continuing the conversation by presenting some of the contents of Self-Help Plus. Can you see my presentation? Okay. Great. So maybe many of you are already familiarized with the content of these two interventions, the Self-Help Plus and Doing What Matters. I won't get into very much detail, just to give an overview for those of you who didn't get in contact with these interventions yet. So as my colleague, Dr. Purgato said, Self-Help Plus, it's a group-based stress management course. It was developed by the World Health Organization, and it is based on acceptance and commitment therapy, which is a modern form of cognitive behavioral therapy focused mainly on, let's say, mindfulness practices. It's aimed at reducing stress and build social support and foster adaptive coping mechanisms and resilience in individuals who are exposed to adversities. These kind of interventions, of course, it can be delivered by mental health professionals, but it's task shifting, which means that also non-professionals can deliver these interventions. And we often call these non-professionals helpers, which can be lay workers, volunteer, many kinds of individuals interested in learning these interventions and applying them, delivering them to the target population. This intervention has an open access, so freely available intervention manual on the WHO website, and I put the links to the English and the Ukrainian version manual in the slides for you to have later. And of course, the University of Verona is offering these trainings. As we said, we also as part of the URISE project, we will be offering these trainings to other trainings who will train the facilitators or the helpers. The Self-Help Plus consists of 5 sessions, and each session is held once per week for a group of about 30 people. And each session is centered on different, let's say, coping abilities or psychological processes. So the first session is centered around grounding, the second on hooking, the next on activating behaviors derived from the participants' values, being kind and making room. So We will enter in more detail about each of the contents of these sessions. The intervention has pre-recorded audios and an illustrated guide to teach these stress management skills, and each session consists of 50 minutes of pre-recorded audio and the rest of interactive activities guided by the facilitators. So usually we have two facilitators who are sure to let the participants know the rules of the intervention and put them the audio files, and yes, to facilitate the participants' activities. We have these, for every session, we have these audio files, which contains the exercises that will be delivered to the participants. And of course, we have the illustrated guide, which is nothing less than the doing what matters in times of stress. So in the first session, I was telling you that is centered around this concept of grounding, which is basically a mindfulness related strategy. It implies bringing the attention back to the present moment instead of being caught up by all these distressing emotions, emotional storms. So just bringing our attention to the present moment. So these are some of the classical standard exercises that we would do in this phase of the intervention. For example, in the first place, we would guide the participants to notice what they are feeling and what they are thinking, the sensation they have. In the second step, we ask them to slow down and connect with their bodies. And for step 3, to refocus on the world around them. And we can do this by directing their attentions to what they can sense, what they can perceive through their senses. So we will ask questions such as, what are 5 things that you can see? What are 3 or 4 things that you can hear? So really bringing their sensations into the present moment. The second the second module, it's focused around this concept of unhooking. And for who is familiar with acceptance and commitment therapy, it's a form of diffusion strategy in which we try to explain to participants that by noticing and naming the things that they are feeling and the sensation that they are having or the thoughts that they are having, this can make stress, these sensations more manageable, right? So in the first place, in the first step, you notice your difficult thoughts. In the second stage, you name them. So you teach participants to name their difficult sensation just by saying to themselves, I am noticing that in this moment I have a difficult thought, for example. And again, we teach them to refocus on what they are doing in the present moment. When we are teaching skills related to values, it's important. So part of the self-help class is to teach participants, guide them through what values are, how they are different from desires, goals, and feelings. Have them identify their personal values and then practice them, which means identify key actions, very specific actions that they can implement in their day-to-day life in order to move forward with their life in the direction of what they hold important, of their values. The being kind in this component, we teach participants to direct kindness either to other people. So we teach them to identify specific activities, specific things to say or to do in order to show kindness to other people. But we also teach self-compassion exercises. So how can they direct this kindness that they often direct towards other people, also to themselves and the difficult things that they are going through. And finally, this making room component is an advanced diffusion technique, which teaches participants to imagine that their difficult thoughts, emotions, and sensations can be viewed as the weather in the sky. So they can notice how, like the weather in the sky, they can go, they can come, and then they can change. So this is also a, yes, an advanced technique that helps individuals to manage their difficult sensations. I won't go through all the evidence for Self-Help Plus because my colleague already touched them. However, it's I think it's good to know that it was implemented in more countries and found beneficial for the participants. Now we are going to talk about doing what matters in times of stress, which, as I said before, is this illustrated self-help guide that we can also find in Self-Help Plus. So the difference between the two interventions is that in doing what matters, we do not need an interaction necessarily with a human facilitator. So participants can apply this kind of intervention, for example, online or digitally. And you can also find the Doing What Matters manuals in English and Ukrainian in freely on a WHO website, and I put them in the link. I just want to note that for the Respond project, Doing What Matters was adapted from a book, digital book format to another digital format, but accessible through smartphone or through desktop. It contains the same 5 modules. It's identical in that with Self-Help Plus. And these are some screenshots that you can see from the Respond project, right, where this intervention was adapted. Here are the different modules, the illustration that appear also in the original illustrated guide, some questions too, so it's also interactive, and of course you have these audio files that help you navigate, give you the instructions for the exercises that you have to go through as a participant. Again, this intervention was applied and tested, as Marianna suggested, in different settings. And again, we found it beneficial. So I just want to conclude this presentation by telling you that we are going to have 2 upcoming events, 2 upcoming trainings in Self-Help Plus and Problem Management Plus. One will be held in Slovakia and one will be held in Romania. You can see here the dates. In Slovakia, we will start in June. We will start with the 3 online session and 5 days in Slovakia. followed by additional training and supervision sessions online. And the same format will be applied in Romania, only that mostly in July. But we will keep in touch with you, and we are going to disseminate these upcoming events as we finish the registration forms for them. So this was my presentation. Thank you for your attention, and let me know if you have questions.
Дякую, Моніка. В мене виникла
Thank you, Monica. And I have a wish to ask our participants, among those who are practicing, facilitating, who actually faced the Self-Help Plus, or, could you please tell us in the chat what is your favorite strategy? Well, please, could you tell what is the favorite strategy of yours is? And I like the unhooking strategy very much. And I would like to thank very much Galyna for sharing this strategy. I paid attention to it when Galyna was talking about it, and I started to read more. I started to read the manual, and I feel now that it is really very helpful. Dear colleagues, and it was very interesting. It will be very interesting to find out from you what is your favorite strategy. And again, I would like also to repeat the information which was shared by Monica at the end, that we are going to start the training for trainers problem management and self-help plus for Ukrainian speaking and Russian speaking specialists in the area of mental health, who at present are in Romania or Slovakia, and respectively the colleagues from the University of Verona, Marianna and Monica, are going to carry out these TOTs in June and in July. And in the chat we have been printing the address of web page, and you will get the English version of the information, and in the LinkedIn Plus there is a Ukrainian version, and we are going to share the information with you about these trainings and the information of how to get registered to these trainings. And we are going to do that in the nearest future. There isn't much time left, so well, if you're a psychologist or you are working in the area of mental health service, who are providing assistance to the Ukrainians in Romania and Slovakia, well, you can enter it in your agenda. And Marianna, if possible, could you again tell us what are the dates of the trainings? Could you please repeat or, screen the slide with the dates of the trainings, both in Romania and Slovakia?
Yes, of course, right now. Okay. So these are the dates. In Slovakia, we are going to start from 5, 8, and 9 June online. And these sessions will be focused mainly on problem management plus. So we will start with this intervention. From 12 to 16 June, we will have this in-person training in Slovakia. We will be more precise with the location when we are going to make available the public announcement. However, it's going to be a full day training, so either online and in person. We will start probably at 9 o'clock until 4, 5 o'clock in the afternoon. So after these in-person trainings, we will have another let's say obligatory session online in 19 June. And after that, we will have on-demand supervision for trainers who will need more support and more information. So the same is true for Romania. However, we will start in 22, 28 and 29 June the online training, and we will going to be in person in Romania, in Cluj-Napoca, more specifically from 3 to 7 July. We'll have this online additional training session, and after that we will conclude again with 1 week of supervision. Of course, our supervision is available on demand also in the next parts of the project, so when the trainers need our assistance.
Дякую. Я ще додам українською, щоб
Thank you. I will add in Ukrainian so that the clarity is, there is a full clarity about everything you've mentioned now, Monica. So it means that in 2 countries, one by one, there will be introductory trainings. There was the training on problem management plus, and then there will be a self-assistance training plus. This is a combined training. Some of them are going to be online, but some of them are going to be in person in the respective countries. And I can see the question in the chat whether the colleagues who at present are in Ukraine to come and attain these trainings on the problem management plus in one of these countries. Dear colleagues, I would like to tell you that these trainings are planned for those specialists who are working in Romania and Slovakia and can provide this assistance to the displaced persons from Ukraine who live in these countries. So when Galyna is going to make her own report, she will tell you where you can get the information about the problem management plus in Ukraine. Okay. And I can see that the chat function is disconnected. So please, you can put your questions in the Q&A section, and we are reading them. We are seeing them. We see them. So we can continue. Thank you.
Okay, thank you. Thank you very much also for your questions. Somebody from, of course, there are more questions in Ukrainian, which I cannot read, unfortunately. Maybe if we don't answer all of your questions, please send them to us via email. So we are more than happy to keep in touch with you. I can read this question from a PhD student at VU Amsterdam. If she can participate to the TOT in Slovakia and Romania. So. I think it's yes, we will give you more information about these things. Okay, so I think that we have to move on with the webinar, and we will proceed with the panel discussion, for which we have additional 3 guests. Dr. Galyna Naumenko is a consultant and trainer at WHO Ukraine. She teaches at the Department of Medical Psychology, Psychosomatic Medicine, and Psychotherapy at Bogomolets National Medical University. She's working on implementing scalable psychological interventions in Ukraine, such as self-help plus and doing what matters in times of stress. And she is also involved in the training of doctors in order to overcome the gap in mental health care. We will also have with us Dr. Giulia Turrini. She's a clinical psychologist and a research assistant at WHO Collaborating Center from the University of Verona, Italy. She has a vast experience in evaluating the efficacy of self-help plus and doing what matters in refugee and asylum seeking populations, but also in training workers delivering this intervention in more countries such as Nigeria, Pakistan, and the Gaza Strip. And last but not least, we have with us today Sam Hunaidy, who works with the International Medical Corps in Poland, and he is a global humanitarian professional and trainer in mental health and psychosocial support. Sam has been involved in research and capacity building for public health services and civil society organization, using his, of course, vast experience as a master trainer and supervisor in these scalable and task-shifting psychological and psychosocial interventions. So now I would like to invite the speakers to take the floor and tell us more about their experiences in working with Self-Help Plus and doing what matter, describing their experiences, sharing with us the achievements and the challenges that they faced along the ways. And of course, I invite participants to ask them questions and be part of the conversation. So let's start with Dr. Naumenko. Please, you have the floor. You prepared for us also a presentation for today.
Так, доброго дня, вітаю всіх.
Good afternoon. I would like to welcome everyone, and I'm going to speak Ukrainian, and it will be going to translate it into English. I'm very happy to see all of you, and it is very nice to feel that that we are working together to, well, it is nice to work in the group of people who think alike, to be useful and to implement efficient tools and to research them. It's absolutely great opportunity, and we have the resource and energy for that. I would like to share my experience. I understand that we have some time limits, but I would like to tell you what I am and what we are doing. I really am a trainer and supervisor of the World Health Organization. And if we are talking about the experience, it is true that we have more understanding of how we adapted this tool since the beginning of the war in Ukraine, the full-scale aggression in Ukraine, how we adapted it under the conditions we live in and to the context we live in, and what helped us, what the challenges we faced. And I will be trying to tell you about it in the nutshell. Just the main phases and success and our wins, victories. And we start our session with the psychological education. And it is important not only the way we are responding to the stress. And these are the pictures from the manual. And the response to the stress is not only the only thing which is important, but also the strategy to deal with it is important. And our key message, which we send at the opening session prior to starting the implementation of the Self-Help Plus tool. We send this message. It's very important to develop new strategies to cope with the stress because the new conditions of life require new skills from us, and not the strategies, all the strategies which use are efficient, and we have to form something new, maybe something unusual, but efficient. And we had some statistics. We carry out the research. It was done not by me, but this was an international company, Gradus degree. It was a survey of the Ukrainians in September 2022. And we can see that there were the symptoms of anxiety, depression, the difficulties with sleeping. And this was done in the environment of the civilians in Ukraine. And the symptoms are increasing, but there is no culture of taking care about the psychological health. And during the war, we understood that we have to make all these, the care of the psychological mental health, we have to promote it much more. And it's necessary to be kind to oneself. Then we will be more efficient in terms of our work, our relations, and implementation of certain plans and ideas. So it's very important for us to take into account these peculiarities of the Ukrainian populations, and so that we send these important messages that we should not minimize the problems in the occupied territories, outside Ukraine, but these problems are important, and we have to take care of them now and here.
So I like using this phrase from the significant skills manual. We are like a community sector. We try to convey this message, and it is important for us to understand the field of our control, what we can influence, what we cannot. And when we speak about these efficient tools, self-help plus and the do what matters, they help revising the attitudes of Ukrainians to mental health, to promote this culture, above all due to scalability of these tools, where we can cover most of the population and really create comfortable conditions for the groups with low level of resources and the facilitator and the physical resources that are limited. And this is done in order that we could develop this positive experience for further identification of more challenging mental issues that require more specialized help, maybe. We say that self-help plus and what matters is an important transitional object or transitional space that will make it possible for people to further on obtain more specialized care if they need that, of course, because maybe the skills that they develop would be sufficient there. I am more a TOT trainer, so I rather have experience in TOT. And these are 4-day trainings. And they include the role of participant, facilitator, and the 4th day is on the role of the trainer. So our participants, they showcase their own skills of implementing the framework of their training, and we give them constructive feedback. This is the agenda of our TOT training. And we have adapted it multiple times, and we will be happy to share the agenda, the structure or plan that we already have. So speaking about the implementation, a lot of steps have been undertaken. Translation, video recording. We were involved into picking up the Ukrainian voice to accompany the group stress management training course. We tried to scale it up to other to various target audiences. We even worked with railway staff and with HR people. So we try to understand how it's possible to diversify that to cover very diverse target audiences. And of course, what's important is support and of the participants at all the steps to see how they're implementing those at different levels and to collect the required information. And it's good that we already have that pool of trainers and we are expanding. I know a lot of colleagues who have been trained with us who are very professional, and we keep learning from each other. And of course, this initiative and this adaptation was possible due to WHO and to support of the national mental health program, psychosocial support, the program initiated by the First Lady, Elena Zelenska. And due to this cooperation, it was possible for us to cover quite significant categories of population. We worked with ministries, above all with the Ministry of Social Policy. Teamwork is very important there. This is our WHO work team on mental health, and that they work in Ukraine, and this is mutually enriching work, and Ken was the leader and one of the first people who brought this tool and showed how it works, and further on we continued expanding it and disseminating. And of course, there were quite a lot of challenges. And speaking about challenges, that's our cultural feature, that we are very distrustful about new things. And usually if we come with new tools, quite unknown tools, this is about mindfulness, relaxation practices, meditation practices, there it is important to explain it to participants why that matters. We're a category of people who pay a lot of attention to evidence base, and quite often we start with very clear messages about why it is efficient, why that works, what mindfulness is. So that's about a greater scale of evidence-based information than you would expect for an SH Plus training course, because it is about lay people, about non-professionals. But I believe it is important to bring in this relevant evidence base, because people have a lot of distrust. So this kind of resistance and bias, that's quite normal, and we are quite we have philosophical attitude to that. And on day 4, participants realize how efficient that is, and they can act as participants and they act as facilitators, and thus understand how it works. So first, it looks like a thank you for teaching us to like reading text and writing, but now they understand that now it is not about this kind of primitive skills. This is about something that works, and that is why by and by the resistance goes down, and they start accepting the role of facilitator that they play, even if it is more passive maybe than the one that we're used to. And it is important to look for ways to implement, to understand the context of particular target categories where WHO can help us, where we don't need help because we have the resources. So this is an important starting point where people have some apprehension. And of course, it is important to realize that not always it is possible to organize full-fledged sessions, like 2-hour sessions. It's important to understand also what we do. What do we do if something happens, like air raid alert and you need to go to the shelter? Shall we just let the people go, or maybe we can work in this stress management skills mode and help them adapt to those situations. Also, what helps us is that we are very convinced that this is an efficient method. We use that in our day-to-day life as trainers, and it is important to showcase that with our own example. And I am grateful to Ira that she mentioned that she likes one of the techniques, and what helps me is grounding and being kind to ourselves, but unhooking, that's also quite helpful. For 2 years, actually, we've been working in this field, but not always in our personal life we can implement our skills. And it is important to by and by add that to our routine, to our life context. That is why mobility, sense of humor, flexibility of the trainer, the capacity to switch and understand that sometimes the context gives us certain certain limits, as well as the target group. So it is important to realize that we will have to, if not limit or shorten sessions, but if there are air raid alerts, that we can probably focus on important skills and in this way shorten the time. But in this 5 or 2 minutes of the audio, we can provide them with some quick tools, and there people can focus and comply, develop their required skills. So that's important. And we worked on adaptation, we collaborated with the ministries, we implemented online activities by and by, and we already have the work group, stress management task team. This is a group of people, community of people in Ukraine who are implementing Self-Help Plus, and currently we have trained 414 trainers. This is what was within the WHO initiative, and it's important to understand that this is the period from June last year till May this year, so now the figure must be different. Me personally, I've trained 171 participants, 10 groups, and they included representatives of the Ministry of Social Policy, social workers, railway company staff, HR people, psychologists who work in various organizations, and also education and NGO staff. So we have very good indicator of satisfaction level, and despite the resistance, the professional level of our participants is of course growing, and they become adherent and involved, and they are ready to implement that as an efficient tool to understand the relevance of it. And you also can see this brief summary of feedback of our participants, what they liked. They liked practical exercises, the very guidebook, audio recordings. They like to practice as trainers, and these are the important, actually, important methods that they like: grounding, unhooking, showing kindness, and that's relevant for them. If we speak about the growing confidence, we had the short questionnaire to check whether people, whether the level of confidence changed before and after the training, and we see a significant increase. In dark, you can see the situation pre-training, and in white, post-training. So we see that their confidence is growing, confidence in themselves as facilitators. Participants are now having more self-confidence as facilitators or co-facilitators, and depending on the target audience, of course, it may vary in the confidence level. And I can say that the more professional people are, the more they specialize in mental health, the less confident they are. So these people tend to be very self-critical, even though we have a lot of experience, and the other way around. The less experienced people have in the domain of mental health, the more confident they are. They are ready to be facilitators and trainers right now. These are interesting observations, and you see that the level of confidence as trainers is a bit lower than as facilitators, but it goes up after the 4-day training. And we say that now we have the strategy, and we want to disseminate that in the healthcare sector, in the education sector. Recently, there was a training at Shevchenko University, National University. There we taught the trainers who are going to promote that at different departments, and it may be, you know, nuclear physics department or statistics department or psychology department. There were faculty from various departments, and further on they will keep implementing Self-Help Plus and do what matters, and among their colleagues, among their students. That's our focus now. And we got positive feedback from our participants. We can see that they are creating this safe space where people can recover, be friendly, and without inducing each other with traumatic experiences and so on. This is a summary after the groups are completed. Let me emphasize that it is important to understand, to focus on this context, understanding the target audience, where we are, who we work with. Each time when we hold trainings, they may be modified depending on the target audience. Maybe there will be more research factors or facts among the professional community. And it's important that you mentioned booster sessions, because we're thinking about how to kind of ground this effect to ensure sustainability. And I believe that this is the work that we now need to focus all of us together. And thank you for your attention. And well, I believe that these tools are about that we can switch, so that we could switch from those very stressful factors around to what is already in the field of our control, where we can already be happy and enriched and move on. So Self-Help Plus, of course, is a very efficient tool there. And sorry if I took a bit more time.
Thank you. Thank you very much for your very interesting presentation. You have done a very impressive work. I just want you to congratulate you. Also receive many hearts from our participants. So really thank you for your work and for all that you're doing for the community. Thank you.
Thank you.
Okay, so before taking a question, I would like to give all the other speakers the opportunity to talk, because we don't have much time left. But Giulia, I would like to invite you now to talk about your experience with doing what matters and self-help class.
Thank you very much for inviting me to this very interesting webinar, and I'm here to share with you my experience in conducting the ACH Plus training of facilitators. I give you some details on these trainings so you can have a more specific idea of what was my experience. I conducted training of facilitators in Italy with the facilitators from Nigeria and Pakistan. And I also conducted a training in Gaza Strip delivered via Zoom. The training in Italy was delivered in Italian with the people fluent in both Italian and English, while in Gaza the trainees were Arabic native speaker and the training language was English. In this case, in Gaza, there was a concern that there might be a language barrier, but there were no problems. In some cases, sometimes the trainees had some difficulties in expressing themselves, but there was a volunteer coordinator that helped me to cover the issues and the training then ran smoothly. Some facilitators had no prior work experience in this field or a formal mental health training. Instead, other facilitators were professionals already involved in mental health programs. Facilitators were unfamiliar with these kind of interventions and with the delivery of these interventions were initially a little confused, but from the second training day they started to gain confidence and they didn't meet any particular difficulties. They took their role very, very seriously. So in the end, I can say that all actively participated to the trainings and all of them were able to demonstrate their skills and were ready to run the groups. The aim of the training of a facilitator was to ensure that facilitators were competent and able to comfortably run a group and to ensure the safety of the participants. But more specifically, in particular, the aim was to prepare facilitators to run ACH Plus groups to people living in a specific context. So the training included a lot of role-playing for a deeper understanding of what they might encounter in the real-world application of the ACH Plus, and especially in Gaza, it was very helpful and useful discussed with the facilitators who were knowledgeable of the context, of course, on the potential difficulties and challenges that they might face during the implementation of the intervention. So, for example, we focused on guidelines and the protocols already existing in their context to manage high-risk situations, but also we have the possibility to discuss the suitability of the intervention for the participants. And, for example, they decided that was more culturally appropriate to run the groups divided by gender. So they run groups with men and groups with women separated. Also, they choose to conduct the groups in non-clinical but community settings to reduce the problem of stigmatization. but also they raised the issue that the participants, the people like to talk instead of listening to an audio recording. And this problem was also raised from facilitators from Nigeria. So we discussed with them how to face this issue. And I'm saying these aspects, these things, because yes, we focused on the contents of ACH Plus and of course doing what matters, but we also had the opportunity to discuss the feasibility, the acceptability and appropriateness of this kind of interventions, and we tried to identify possible solutions. Also, we had the opportunity to supervise facilitators from Nigeria and Pakistan and to assess the fidelity, so the session adherence, and we found a near perfect fidelity. Yes, we found some minor deviations related to the timing, because as I already said, people wanted to talk more in the large group, so facilitators spend more time for discussions, but then we discussed this point with our facilitators and they came back to the manual. Also, we collected some qualitative feedback from our participants, and they most of them, they were very happy to attend the groups because they created a sort of relationship with the facilitators who had the same or similar background, but also my experience was that also participants created a relationship between them. So this was my experience, and I can say that in the end all the facilitators, professional and unprofessionals, were able to acquire the capacity and the technical skills to run the groups and to properly deal with the challenges and difficulties and high-risk situations. And this was my experience.
Thank you very much, Giulia, for sharing with us your experience. It was very helpful hearing about some of the challenges that you experienced, and maybe our next speaker, Sam, will also share some of the problems, the challenges that you mentioned before. So I would like to invite into the conversation our colleague Sam, who is freshly out of the training of trainers in Poland. So we are looking forward to hearing your story, your perspective, please.
Thank you very much. So we just actually completed a training of trainers in Self-Help Plus for mental health professionals. So with the URISE project, we finished the training at the last week of April, and we had other trainings as well in Self-Help Plus as TOTs. So the trainings were very successful. So we got very much positive feedback about the trainings in the beginning. I have to also second what Galyna was saying, that our Ukrainian colleagues were actually quite resistant to having a new, expressing that this is something new, they are not used to it, and also feeling that the role of the facilitator is kind of less active than we are used to in terms of having a pre-recorded audio session that guides actually the session. So in the beginning, there was some kind of like resistance and doubt, but throughout the exercises and throughout the training, and also how the practicing the skills actually and running throughout the training, we tried to have every trainer run all the sessions. So every trainer got to actually run in small groups all the sessions, and then it made sense to them. It resonated better. So after the TOTs, we decided with the new trainers that they will do a cycle of running practice groups of Self-Help Plus. So they get to actually be in the role of the facilitator themselves, get insight and first-hand practice of how the groups would be, how running groups would be. And they agreed that they will run the groups in pairs as a facilitator and co-facilitator. So we are very excited about that. The first actually cycle of practice groups have already started. So we are, 2 groups have started and we are in session 3 in the group this week. So we are, our team at International Medical Corps is providing supervision and support. So we are offering weekly supervision online and in person, according to availability, individual and group, to meet everyone's also work schedules and plans. We will be also, the supervision will be ongoing. So as much as needed, first into the practice groups, and then afterwards into preparing for trainings, setting up their agendas and their exercises, and also running the training itself. So we are also very excited about that, and supervision will be also ongoing for it. We did have some challenges, of course. Other challenges that people were a little bit doubtful about is the availability of the newly trained facilitators. So first of all, the commitment of the trainers itself was a question, because some of them were like, our workloads are high, and sometimes there are priorities related to work and to their managers. So the availability on the long term of implementation of doing Self-Help Plus trainings of facilitators could be sometimes challenging to predict. And at the same time, also the availability of facilitators who will run further the Self-Help Plus groups. So these were challenges identified for the long-term implementation. Also for supervision. So there was, of course, we are providing supervision until the new trainers become supervisors for their facilitators. And also questions about supervision has been raised, that some of the new trainers are saying, maybe we're not ready to be supervisors yet, or maybe I'm not ready to support other colleagues and take on the responsibility of supporting also their well-being and their self-care along the way. So there is some resistance about that. So we are in discussion. We are trying to develop as a team a way of how we can support the new trainers to be supervisors effectively and be supported along the process. So it is gonna be an exploration further the way we go on with supervision. There is also so in terms of the trainings, so we did them in training were done in English as in person. We did them all in person in English with simultaneous translation into Ukrainian. And the attendees, the majority of them were Ukrainian colleagues of mental health professionals. And we had also a few Polish colleagues as well, working with displaced Ukrainians and third country nationals. So the groups will be run, some of them in Ukrainian for Ukrainian colleagues, and some of them in English for third country nationals that are present in Poland as well. And we had a lot of ideas, so we brainstormed with the new trainers ideas of how they think they would implement the trainings, but also who are the target groups of facilitators, and where beneficiaries for Self-Help Plus, so participants, could actually benefit to start with, to reach out to. And we thought shelters can be a very good start to create in the shelter a supportive atmosphere for people living at the shelter themselves when they practice together, join the groups together. And we also thought of one of the groups actually started is for parents of children having challenges joining Polish schools here, and also for persons who are there were ideas about persons who started also to continue their education, so they had to stop in Ukraine and they had to continue in Poland. So there were a lot of ideas on where this could be helpful. And to confirm with Irina, actually the majority of the new trainers in the training said that they like a lot the unhooking concept and the actually psychoeducation about emotional storms. This was very like to have it as a clear idea and to have it explained what emotional storms do to us, how they affect our function in every day, was very interesting and informative, as simple as it is, but it is very informative and good to have it explained like this. So our future plans will be to keep following up with the new trainers and to also develop a supervision model to help them, also train them on being supervisors, and to follow up on supporting them rolling out the trainings. So hopefully in the future, in the coming, in the near months, actually in the beginning of summer, we start with the trainings, and hopefully also the cycle of the practice groups give us more insight about what these groups and what the trainers will collect feedback from participants about how they experience the trainings, how they experience listening to a guided audio pre-recorded session, and how also the facilitators, the trainers will feel as facilitators. And this will help them actually gain a lot of insight how their trainings would be and how to adapt their trainings according to also the context and the target groups that they will have in their trainings. Something to add about doing what matters in times of stress. So we, IMC, we implemented doing what matters in times of stress last year, accompanied with our psychological first aid trainings. And we added doing what matters in times of stress, incorporated with self-care workshops for service providers. And we found it very, very helpful. We had great feedback actually from service providers of Ukrainian colleagues working to help also other Ukrainians, how it was helpful to them to take care of themselves and be able to actually help others while they also are experiencing the same challenges and the same difficulties that the people they are helping are also experiencing. So the grounding, the unhooking, being kind and acting on your own values was very, very helpful to them. And it was interesting to get this feedback this year as well, because some of the trainers, the new trainers that attended Self-Help Plus and Problem Management Plus as well, also attended these self-care workshops, and they were reporting back to us that they have been using this to actually help their colleagues as well to feel, so they taught their colleagues about doing what matters in times of stress and the skills and the strategies in it to also support each other. So we were very glad to hear that, and I like to share that with you. I think this is for me so far. Thank you very much for the time. I know it's already past the planned time.
Yes, thank you very much for sharing your experience. It was very interesting hearing the particular things that that are happening in your experience and in Poland. Thank you very much. Irina, do you think that we could answer to some questions?
Я б хотіла ще... Так, дякую. Я б хотіла ще зазначити те, що я почула.
I would like to underscore the following. Everything I've heard, both Sam and Giulia mentioned that there was a feedback from the participants of the training, and this feedback was about the negative attitude to the listening of the pre-recorded sessions. And Giulia said that people want more personal contact and dialogue. And Sam also shared his experience, and he said that these pre-recorded sessions maybe are too long, or maybe there are no sufficient pauses. So participants actually have comments to these pre-recorded sessions, but Galyna didn't mention anything about that. Galyna, did you hear these comments? And if you heard these comments, what do you do about it? Well, I've mentioned it, yeah, I've mentioned it. Maybe I was talking too fast. Yeah, really, the too long recordings are not very positive. Too long. And, well, maybe we can discuss the too long recordings. People choose and are willing to have some live communication. Maybe, well, these texts should be read by individuals. It is true that this problem exists, but the question is of how you explain it in the context of the group you're working with. From the first meeting, on the first day, we are explaining why, and we are looking at pros and cons of the audio recordings. Because the participants have counter arguments and pros and cons were mentioned, but we are discussing it, and we actually come to the consensus, because this is, saving the energy of the facilitator, minimization of the contact with the traumatic experience, so that they do not infect each other, and so that they will be very caring about each other. And also, this is a training model. We are discussing the key points. We are saying that these are training sessions. So here and now, you will be able to start helping yourself and helping others. And with these messages, it is easier to continue working with our participants. But in the future, when we are overcoming this resistance, then I can see that the participants really love watching the behavior of each other, how people are doing these exercises, and this community is being formed on non-verbal level, but it's very comfortable and it's safe, and it helps. I can see that we are taking too much time, but maybe, well, we have to give the opportunity to ask questions. Giulia can ask other trainers, or Alina or Sam, and then we will try to complete our webinar in 3 to 5 minutes. Any questions from the participants of the panel discussion to each other? I would like to mention, Sam has a question. Yeah, Sam has a question. I would like to just 2 words. There is an algorithm in these sessions, but we are very flexible. We had some fuck-ups when we were not fitting into the timing, and some session was missed, and we did not have time for 2 hours. But we have justification because we are working under conditions of war. I'm joking, but it's not funny. It's not a funny joke at all. But we say that we can give very short exercises to develop very important skills, and these are life hacks for us. Sam has a question.
So it's a brief question. Thank you. Related to actually what we were discussing about the audio recording. So in my perspective, and I want to check your feedback, guys, as trainers as well, because in the trainings we discussed that the audio recording could be actually, there is a lot of room for improvement on how the audio recordings are instructed. Yeah, so there isn't, so the reception, I feel that the difficulty in the reception of having a pre-recorded intervention could be less if the audio recordings are improved in terms of giving a little bit more space to the facilitator, more active role to keep the empathy that people long for in groups, while still keep the facilitator safe, like Galyna mentioned, in terms of having less contact with the traumas or with the challenges of others. So there could be improvement done to the recordings and the way they are instructed. But this will be, I feel this will be like a long-term experience that we will gather together, getting the feedback from the trainers and from the facilitators and how they experience the sessions and how participants experience the sessions. And maybe after that, we have a new improved version of the recordings, which will be very interesting to follow upon. So I wonder if you guys had a similar experience as well, or feedback in your trainings.
Дякую. Giulia, можливо, у вас є питання?
Thank you, Giulia. Maybe you have a question.
Yes, I was thinking to my experience, for example, with Pakistan facilitators, that this was very different from Nigerians because they follow the pre-recorded audio very, very well without long discussions in pairs or in group. So I think that maybe it could be also a cultural aspect. We realize that Nigerians loved talk together, talk with facilitator and co-facilitators. Yes, this is my experience, but also I share what Sam and Galyna told before and shared before.
Дякую. Дякую. Я хочу ще раз
Thank
нагадати,
you. And I would like to remind you once again that in the chat box, you see links to social media of our project, the website, YouTube link. There you can watch the recording, and also the Telegram group on stress management in Ukraine that brings together facilitators and trainers for self-help plus and do what matters and resource materials. And I believe that colleagues we can wrap up here. And I'd like to express gratitude to Verona University. Thank you for organizing the webinar. And we are grateful to the colleagues who have agreed to share their experience. And yes, Monica, if you have anything else to say before we wrap up, you're welcome.
Thank you very much for participating to our webinar. Thank you to the participants and to the speakers, of course, and to you for co-hosting this event. I would like to also thank our interpreters who did such a good job. And yeah, I encourage participants to stay in touch with us and really just write to us if they have any additional questions. We are more than pleased to extend this network and have them as part of our community. Thank you very much.